Hi, everyone. This is Bob Imler, CEO of Sunset Support Services. Just wanted to give you an update on COVID-19 and Sunset's processes to stop the spread of COVID-19 throughout the community. So the first thing I wanted to mention is we are updating our policies and procedures concerning COVID-19, and those will be available on Therap's website under the agency tab, under document storage, and it'll be listed under COVID-19. But couple things that I did want to show you concerning the policies and procedures, and also concerning ODPs and the Department of Health's statistics concerning COVID-19 for Cambria County. So the first thing I want to show you is one of the big recommendations that ODP is doing is not stopping, but creating policies and procedures in regards to the visitation of our individuals, where other individuals can visit the houses, families can visit our houses, but at the same time, individuals being able to go to other people's houses, and basically what we have in place to stop the spread of the virus in case it comes in the sunset. So under the pandemic guidelines, I have actually went ahead and updated policy 3003, or actually no, 3004. I'm sorry. So basically, I'm going to talk to you a little bit more about what is called a PCR testing. So basically, what PCR testing is basically a formula that is used by the Department of Health to go ahead and determine how the community is able to get COVID-19. The higher the number, of course, the worse of a chance of getting COVID-19. So basically what it does is it looks at the number of positive cases of people that were tested versus the amount of people tested that came up negative. So basically, for example, if 100 people were tested and 3 came back positive, the PCR is actually going to be 3%. So ODP basically considers levels of community transmission in the counties considered into 3 different types of phases. They are the low phase, the moderate phase, and the substantial phase. So basically, what I liked before is whenever we were first doing changes with COVID and we were coming back into being able to do things, they had a yellow, green, and red system that I would like to use again as well. So basically, with the low, basically that percentage is less than 5%. In moderate, which basically I consider yellow, that's between 5 and 10%. And in substantial, you're looking at anything that's over 10% of a PCR. So as far as how that's going to affect the individuals and the abilities to visit other homes, for people to visit their homes as well, we are looking at, with the green phase that's less than 5%, we have the abilities to go ahead and visit pretty much as much as we want, as long as you're following the protocols that we have in place, which are listed down below that I would like for everyone to read. Under moderate, whenever it comes to 5 to 10%, all indoor visits need to be canceled. And this is basically what we're going to be discussing here in a minute with the numbers that just came out about a half an hour ago. Substantial is anything that's greater than 10. So basically, anytime, whether or not the visits are indoor or they're outdoor, which in the moderate phases, we're going to be able to participate in a lot more, or we need to participate in a lot more of the outdoor activities. Whenever a county is substantial, we cannot do any in-person contact unless it is granted by one of the medical coordinators here at Sunset. So with that said, these are the numbers that were just provided by the Department of Health. So if you click on the map of Cambria County and you scroll down, our PCR currently is at 5.5%, which means that we are now in the yellow phase. So back to what I mentioned before concerning visitations. So moving forward, at least for this entire week, individuals cannot go to other individuals' homes nor can they go anywhere to visit due to these recommendations that ODP and the Department of Health are giving us concerning that. You can, as far as being in the yellow phases, people can go outside. We can still go to parks. We can also still go to the grocery stores as long as we're following proper social distancing. Now, however, let's go back to the map and let's look at Blair County. So they're currently at 8%. So they're still in the good as well. But if you were looking at Huntington County, 9.5, and if you're looking at Blair County, 17.5. So there's definitely a high outbreak of cases of COVID in that county. If we look at Indiana, Indiana is at 14%. So back to our policies and procedures that I just updated. We want to ensure that U.S. staff members, we cannot transport individuals to areas that are considered red. So if we have any planned outings that are in Indiana County, since they are in the red stages right now, we cannot take those individuals to that particular county that are currently in the red. So as of right now, Blair County is good to go, but Indiana, Bedford County, those are areas that staff are not permitted to take the individuals to those counties. I know it's a lot to take in. All the policies and procedures, like I said, are listed on our website under SharePoint, under COVID. They will be updated by the end of the day before I leave to go ahead and make sure that you have the most up-to-date information concerning that. But right now, our number one concern is to ensure that the safety of our individuals and also the rest of the staff members that are here is number one priority. So I know that there's a lot of the individuals are going to be mad and upset that they're not going to be able to go out and about in the community as much, or they're not going to be able to have visitors in the homes. But we got to remember and we got to encourage and let the individuals know that we're doing this in the best interest of them. Thank you so much, everyone. Have a great day, and I will talk to you soon.